Have you ever heard of fibroids? Well, if you haven't, you're about to learn something new today. Fibroids, also known as uterine myomas or leiomyomas, are non-cancerous growths that develop in or around the uterus. Imagine small, benign tumors growing where they shouldn't be. They vary in size from tiny seedlings that are almost undetectable to the human eye to bulky masses that can distort and enlarge the uterus. Now, you might be wondering, how common are these fibroids? That's an important question. It turns out they're quite common, with around 3/4 of women developing them at some point in their lives. However, most of them don't even know they have fibroids because they often don't cause symptoms. That's a brief introduction to fibroids for you. Intriguing, isn't it? Now that we know what fibroids are, let's delve a bit deeper and find out about the different types. Did you know there are different types of fibroids? Yes, indeed, and these varieties are primarily based on their location within or on the uterus. First up, we have intramural fibroids. They're the most common type and grow within the muscular uterine wall. These can expand, making your womb appear larger than it is. Next, we have subserosal fibroids. These fibroids develop on the outer uterine wall and can grow quite large. Sometimes they might even make your womb appear lopsided. Lastly, we have submucosal fibroids. These are the least common type and grow just beneath the uterine lining. They can cause heavy menstrual bleeding and prolonged periods. Remember, each type of fibroid may present different symptoms and complications. Their size and how they grow also vary, and these factors significantly influence the management approach. Understanding these types is crucial, but knowing the risk factors is even more important. So let's delve deeper into that in the next scene. What makes a woman more likely to develop fibroids? This question has intrigued researchers and medical professionals alike. Several risk factors have been identified, and among these, age is a critical one. Fibroids are more common in women in their 30s and 40s, up until menopause when the risk tends to decrease. Family history also plays a significant role. If your mother, sister, or grandmother had fibroids, your chances of developing them may be higher. Ethnic origin is another factor. Studies show that African American women are more prone to fibroids than their counterparts from other ethnic groups. Next, we have obesity. Women who are overweight are 2 to 3 times more likely to develop fibroids due to higher levels of estrogen produced by fatty tissues. Lastly, eating habits, particularly a diet high in red meat and low in green vegetables, can increase the risk of fibroids. So we've talked about the risk factors, but what are the signs that someone might have fibroids? How do you know if you have fibroids? It's a question that might be on your mind, and the answer lies in understanding the signs and symptoms. Fibroids often present a variety of symptoms that can range from mild to severe. One of the most common symptoms is heavy menstrual bleeding, which can sometimes be accompanied by prolonged menstrual periods. This isn't just about inconvenience, it's about a significant change in your body's normal functioning that may need attention. You may also experience pelvic pressure or pain. This discomfort is often described as a feeling of fullness or tightness in the lower belly. Another telltale sign can be frequent urination. This happens when the fibroids press against the bladder, causing you to feel the need to urinate more often than usual. Finally, some women with fibroids may experience constipation. This is due to the fibroids pressing against the rectum, making it more difficult for stool to pass. If you're experiencing these symptoms, it's important to get medical advice. But what can be done to treat fibroids? If you're diagnosed with fibroids, what are your treatment options? Well, the treatment approach often depends on the severity of your symptoms and your personal health goals. There's a wide range of options, so let's dive in. First, watchful waiting. Here, nothing is done, with the hope that the fibroid tissues will atrophy. Secondly, medication can be a viable option to manage symptoms. Hormonal therapies like birth control pills or progestin-releasing IUDs can help control heavy menstrual bleeding. Then, there are non-invasive procedures like MRI-guided focused ultrasound surgery, which uses sound waves to destroy fibroid tissues. More invasive options include a myomectomy, where the fibroids are surgically removed, or a hysterectomy, where the entire uterus is removed. These are generally considered when fibroids are large or causing severe symptoms. Lifestyle changes can also play a key role in managing fibroids. A balanced diet, regular exercise, and stress management techniques can contribute to overall well-being and symptom control. Fibroids can be a challenging condition, but with the right information and medical advice, they can be managed effectively.